Angiotensin-converting enzyme inhibitors are the first-line treatment of hypertension in patients with variety of compelling indications include high coronary disease risk, history of diabetes, kidney disease, and stroke. ACE inhibitors include captopril, enalapril, lisinopril, prindopril, and ramipril. It can be seen that they all ends at suffix "pril". ACE inhibitors work by interfering with body's renin-angiotensin-aldosterone system. RAS is a complex system responsible for regulating body's blood pressure. Liver synthesizes angiotensinogen, which is the main substrate for the reaction. Kidney release an enzyme called renin in response to low blood volume, low salt level, and high potassium level. Renin catalytically cleaves their circulating angiotensinogen and forms angiotensin 1. Angiotensin converting enzyme then converts angiotensin 1 to its physiologically active form angiotensin 2. Angiotensin 2 stimulates the release of aldosterone, which stimulates water and sodium reabsorption, thereby increasing blood volume and blood pressure. It also causes contraction of the muscle surrounding blood vessel and effectively narrows the vessel and increases blood pressure. Angiotensin converting enzyme inhibitors decreases the systolic blood pressure. Thus, these inhibitors reduce mortality and morbidity in patients with systolic heart failure and with impaired left ventricular ejection fraction. Angiotensin converting enzyme inhibitors helps to relax your veins and arteries and lowers the blood pressure. They prevent the enzyme in your body to produce angiotensin 2 and narrows your blood vessels. This narrowing can cause high blood pressure and force your heart to work harder. ACE inhibitors effectively reduce systemic vascular resistance. These antihypertensive efficacy probably accounts for an important part in their long-term renoprotective effect in patients with diabetic and non-diabetic renal disease. Dry cough occurs in 10 to 15% of the patients treated with ACE inhibitors due to accumulation of bradykinin or prostaglandins in the lungs. Excessive doses of ACE inhibitors are usually well tolerated but can cause hypertension, drop glomerular filtration rate, and can also cause electrolyte derangement. Skin rash with ACE inhibitors is thought to result from increased level of bradykinin. ACE inhibitors reduce proteinuria by lowering intraglomerular pressure by reducing hyperfiltration, and these drugs tend to raise potassium level and reduce glomerular filtration rate.